we're ready to go. Okay, so we're going to be inspecting the head and face. So first we'll be noting the shape and size of the skull, just inspecting visually, making sure we're not seeing any signs of acromegaly, Down syndrome, anything like that. And then we're going to be checking for the position of the head, noting any torticollis or unusual way in how they're holding their head. And then we're going to be looking at the shape, color of the skin of the face, noting any scars, any tumors or anything like that, the color, discoloration, any puffiness, edema, swelling. And then we'll be going to note the shape and symmetry of the face. So we'll be looking at the eyebrows, the eyes, the nose, and the lips, making sure everything appears symmetrical on the patient's face. And then we'll be looking at the hair on the individual's head, noting any odd things with that. Also facial hair, and she's good with that. And then we'll be checking the scalp, just looking at that, the texture of that, making sure that that doesn't appear scaly or that there's scars or nits in the scalp. And then we're going to go on to palpation of the scalp. So we're going to be palpating for any masses or tenderness. So let me know if there's any tenderness with any of this, and just getting a broad global check of that. And then we'll be palpating the parotid gland, making sure that doesn't appear swollen, and she feels pretty good there. And then we're going to percuss the frontal and maxillary sinuses. So perfect. So I'm gonna just gently percuss there. Any pain with that?
Nope.
And then gently percuss the maxillary sinuses. Any pain with that?
Nope.
Or tenderness, discomfort? So that appears normal. And then we're going to go on to auscultate with the bell side the temporal and orbital arteries. So first we're going to go like this on this side, and then same, we'll come around over here. Good. And then I'm going to have you close your eyes for me, please, and you'll feel my hand right here, and we're gently going to put this over the eye there. Good. And then same thing on this side. And checking, we shouldn't hear any bruise or anything. That should be normal to not have those. And then we are going to go on to checking the cranial nerve. So we're going to start with cranial nerve 5. And first I'm going to be I'm going to gently just stroke your face with your eyes closed, and you let me know if this feels equal on both sides.
Yes.
Feel both the same?
Yes. Yes.
There we go. So she's good there with the sensation part. And then we are going to take a tongue depressor, and I'm going to have the patient open her mouth. And I'm going to slip this in between your teeth. I'm going to have you bite down. Good. And don't let me pull it out. There you go. Good. And then other side, same thing. Good. I'm going to pull it. Good. And patient appears normal with that. And then we're going to gently tap the eye. So I'm going to first have your patient look up so I can come underneath the eyelashes. Good. I'm going to have you look away. Good. Come in and gently tap the eyeball. Very good. And then we'll be coming around to the... Oh, yes. And then I'm going to use the other swab actually, so we don't cross-contaminate. And I'm going to come in, same thing, lift the eyelash up, have the patient look the opposite way, come in and tap the eyeball. There we go. That's cranial nerve 5. And then we'll be doing cranial nerve 7. Cranial nerve 7. I'm going to have the patient wrinkle their forehead for me. There you go. Good. And then can you puff your cheeks for me? Good. And then smile and frown. Good. And that's that. She's a healthy one.